summer, and that means bug bites, sunburn, and poison ivy. So what do you need to know this season to prevent any problems? Well, joining me now is Dr. Vasanth Kainkaryam, I said that correctly, from Hartford Hospital with, what are really some of the problems that we see during the summer? I know we mentioned first bug bites.
Correct. There's a lot of bug bites, tick bites. We see a lot of it this time of year. People are outdoors having fun, and really important to be proactive in preventing them. There's a lot of bug sprays that you can use. There's some evidence that DEET might be beneficial. So really trying to be proactive, wearing long sleeve shirts, long sleeve pants, particularly when you're doing some gardening. These are some simple things that you need to do to stay preventive. What
should you watch for? I know ticks with Lyme disease can be a big thing. Not only for you but also your pets can bring them into the house. Right. What kind of symptoms do you need to watch out for if you're looking at something like that, if you've been in a wooded area?
Correct. So Lyme disease is interesting because it actually requires two infections. The tick has to be infected, and then that has to transmit the infection to you. So typically the classic symptom is this bullseye rash that appears around the area, but some people might not have it. Some people might just feel tired, achy, feverish, fluish. So really a lot of it's putting the symptoms together, and if you're not sure, go see your doctor. Make sure you get it checked out.
Right. Same thing with those like mosquito-borne illnesses as well?
Exactly, yeah. A lot of them can be pretty non-specific. So, really, if you're not feeling well, make sure you get it checked out because it could be one of those.
All right, let's talk about another thing that we see during the summer. I know I've become a victim to this myself. Poison ivy.
Yes.
Do you just have to avoid it altogether? I mean, what do you do?
So poison ivy, actually, like you said, it's pretty common, up to 50% of the people who get exposed, and it's really actually the oils in the plant. So if the plant is damaged from the weather or you brush up against it, the oil penetrates the skin, and that's really what causes your symptoms. So wearing long sleeve shirts and long pants are helpful, but IV block you can buy over the counter. That might also be helpful. And really, if you've been exposed, you really want to wash the oils off very quickly. So within 10 minutes, you can actually get about half the oils off. If you wait an hour, pretty much it penetrates the entire skin.
Wow. And there are different things that you can put on the poison ivy if you do get it as well.
Correct. I mean, there's some topical things. A lot of it, you can use calamine lotion, you can use aloe. Poison ivy, even if it's untreated, will go away in about 3 weeks. So it will go away, but for symptom relief, sometimes we'll use a steroid cream or even give oral steroids depending on how bad it is.
Let's talk about the last thing on our list, sunburn. I mean, we all know we should be slathering on the sunscreen when we go out, but why is it so dangerous?
So the mechanism of sunburn is actually thought to be damage that's happening at the DNA level. So damage to your DNA can cause long-term consequences, increase your risk of having skin cancers and melanoma, and that damage is what causes the inflammatory process that's thought to produce sunburn. So while in the short term, you might have blisters, you might have oozing discomfort, in the long term that really can increase your risk of having skin cancer, particularly if you're light skin, blue eyes, light hair. Those are all high risk factors.
And I know this is an obvious question, but we're going to hear it from a doctor. Yes. What should you do?
So really, you want to be using your sunscreen, SPF 30 or higher at least. Wear it 15 to 30 minutes before you go outside, and then every 2 hours afterwards. Even if it says it's water resistant, it can still come off. So if you're around the water, please make sure you're putting it multiple times.
And usually what I've heard in the past is if you go in the water, when you come out and dry off, just put it on again.
Exactly.
Just to be safe.
Exactly.
All right, well, thank you so much for all those tips. Hopefully no one has to take them. Well, they'll do the preventive things so that they don't have to come to the doctors with any of those summer woes, as we'll call them.
That's our goal.
Thank you very much. Well, straight ahead, the